on the crowns, determine what order the mercury needs to be removed. And just a disclaimer here, I tell every client, I am not the dentist. The dentist has the last word on everything. I am merely giving information so that the dentist can make a more informed decision. And that's important because I don't want my clients going to the dentist saying, Millie says you've got to do this. No. The dentist is the one who's got to decide what to do. Okay, determine how much time there should be between amalgam removal, and we can look at, usually what I do is look at quadrants, which quadrant first, upper right, lower right, blah, blah, blah. Do we want 1 month, 2 months between amalgam removal? Some people are very, very sensitive, and you've got to just give the body time to recharge. And I know that, there's conflicting things there. It's like get them all out within 2 weeks and, all sorts of things. But I just test and see what information comes back to me. Determine what nutritional supplements you need to support the system through the process. Just some of the adverse metals that we assess for. All of those, we just run through them all. Lots of nickel crowns on all these children nowadays. Just a case study here, I put these in. This was a client who showed up with a lot of stress on the lymph drainage of the jaw. Now the lymph drainage of the jaw tells you a lot of what's happening in the mouth. So I asked some questions, and it turned out that she had a crown on tooth number 2, which showed a lot of stress as well. So I just ran quickly, and sure enough, we picked up some mercury showing energetically indicated on that tooth. And we went and looked just a little further, and it showed that that meridian pathway would be balanced with mercury amalgam removal and with a non-metal crown. There was indication of some galvanic response, and it also showed that the nerve was a little inflamed. So then I write up a report, send it to the dentist, and he can decide what to do. Thank you. Well, I've got both hands going now. What to do. Okay, so very tricky thing to assess dental pulp, because sometimes you just don't know. But we can go in and see, is it an acute pulpitis, a chronic pulpitis? Is there a deterioration or degeneration? Is there gangrene? Is there infection? Or is the tooth inflamed or necrotic? Is there an irreversible pulpitis or reversible? And is the tooth viable? And again, I just defer to the dentist. I'm just giving information and leave it in your ballpark as to what you do with that information. What is the cause of the pulpitis? It's always valuable to address cause. Is it a bite problem? Is there a cracked tooth? Is the cause decay, or are they pathogens? Is the cause energetic? Is there exposed dentin? Or is the cause the restorative material that's being used in that tooth, or is there a toxic burden? And then how best can we treat that? Will antibiotics be effective, or homeopathic remedies? Will laser or ozone therapy be effective, or can we treat with nutritionals and herbals? So it gives us a lot of information as to next steps. Or do we need to treat with a root canal? There's a time and a place for everything. This is not preaching to the converted, just thought I'd put it in there. Dr. Meinig and Dr. Weston Price's work, you're probably all familiar of the work that Dr. Price did with taking out a root canal tooth in an arthritic woman and putting it 48 times into a rabbit and then crippling the rabbit. Okay, we know all that. So when we evaluate a root canal, what do we want to look at? We want to look energetically. What is the tooth exhibiting? Is it inflamed? Is it degenerative? Is there stress? Just giving us an idea of how the body is handling that tooth. Sometimes in my general assessment, I'll just go and check a root canal tooth, and just see, is it still okay? And year in, year out, you can just energetically check that tooth to see if it's okay. If it's okay, great. Determine if the root canal is energetically acceptable. Test for the location of the stress. Is the stress in the tooth? Is it at the root tip? Is it in the surrounding bone? Thinking of cavitations. Test for the cause of the stress. Are there pathogens? Is it a failed root canal seal? Is pathogens escaping from the tooth? Is there an apical cyst? Is there a cavitation, a cracked root, or incompatible dental material? And we can also assess for the effect of the stress on the body. Is there a toxic burden to the body? And this is, is there irreversible effect on the acupuncture meridian? Are there allergic reactions or galvanic currents? Or is there an infectious source? Does the tooth need to be extracted? And again, I'll tell my clients, this is not my call. I will give the information to the dentist because I don't want to tell somebody they've got to have a tooth extracted. If energetically it indicates that a tooth does need to be extracted, does it need to be extracted because of toxicity or because of an inability to achieve an apical seal, because of a cracked root or irreversible effect on the acupuncture meridian? We've heard that, in naturopathic fields, they say that if a person keeps coming to you and you can't get them better, you can't get them better, you can't get them better, you have to look at the mouth. And it is so true. You have to look at the mouth. And so many people will spend thousands and thousands and thousands of dollars on their body and have a mouthful of root canals or amalgams and be so reluctant to do that work. Okay, so looking at just a case study here on a root canal. On tooth number 8 and 9, I think this was a young woman who fell and hit her head on ice and damaged these front teeth, and she came in, she had chronic cystitis. She came in and saw me, and I just quickly asked some questions and quickly checked those front teeth. And sure enough, they showed a lot of inflammation with stress on the tooth there, and sent her to a dentist. And the dentist called me and said, "How did you determine this? How did you know that there was some infection up? There were some abscesses actually up above those teeth." Anyway, he cleaned them out, and she came back, and we evaluated them, and they came right back into the normal range there. Very happy client. Also, just what we can evaluate with NICOs. Obviously, just evaluate the tooth. Remember, I said it's the root canals and the extraction sites that we're most concerned about. Determine if cavitation is energetically isolated. You have my terminology, energetically isolated, because that is what I'm doing. Energetically seeing, because that's the field, the technology that we're using. So I have to use that legally, Sometimes you get a bit tired of writing energetically, but just to cover ourselves legally. Energetically determine the level of cavitation, 1 through 4. And energetically assess if surgery is required. And determine if homeopathic or Sonum remedies would balance that tooth. Just automatically, I run through all the Sonum remedies, give that information to the dentist. So if the client does go to a surgeon, they have that information as which Sonum remedy would be most effective for that client. Assess the blood flow and the lymphatic drainage, because this really lets you know whether the body has the ability to heal. If the lymphatic drainage is compromised, the healing process is going to be compromised. The same with the blood. Also, we want to energetically assess for toxins, whether it's local or systemic. We want to see if they are incompatible dental materials, maybe a bit of mercury on the tip of the root or whatever. Cadmium, pick up cadmium all the time on root canal teeth. Is the immune system compromised? Very, very often we'll see that the immune system is compromised. Is there a head and neck infection? Are there fungus, bacteria, parasites, viral burdens, and you can find them all. And we can actually go in and isolate what fungus, what bacteria, what viruses, what parasites. Are the tonsils infected, or the adenoids? Is the mastoid or sinuses infected? Or the gums and the lymph nodes? And does the cavitation extend beyond the alveolar nerve? Very useful information for a surgeon. Post-surgical EAV follow-up with supplementation is also critical. You want to make sure that they can eliminate those toxins, because if you do surgery on a cavitation, you're releasing a whole bunch of nasty pathogens into the bloodstream potentially. You want to make sure that the body has the ability to eliminate those toxins. And, we use homeopathic remedies and any number of nutritionals here. Just a case study here. Here we picked up on tooth number 20. This person was presenting with like a leaky gut, digestive issues. And on this tooth, she showed inflammation with a lot of stress. We went in and we determined that there was a level 4 cavitation. You see it patches at the 48.9 there. Now I just put in her stomach meridian because it's a 27.7. So her stomach meridian was annihilated. Pathetic, So it's not surprising that she had digestive issues. So she went and, other things we found. We found a fungal burden. We did find lymphatic drainage impaired. And we also found a viral burden here. She went and she had cavitational surgery done. And she came back a few months later, and the tooth looked beautiful. There it is, just awesome. Her stomach, however, took a little longer to resolve itself. There it is, it's a 40.8, better than a 27. So at least we know we're moving in the right direction. Still a lot of stress on that meridian. It took until December 2004 for that stomach meridian to come all the way back into the normal balanced range there. Just another case study here. A guy presented with tachycardia just all of a sudden. Well, we know that the wisdom teeth sit on the heart and small intestine meridian, so I just quickly jumped, and looked at all 4 wisdom teeth sites and found that on number 16, it was showing a lot of stress. Looked a little further, we found there didn't appear to be a cavitation, but there was a viral burden. And it turned out that it was the shingles virus. So we gave him a little homeopathic remedy for shingles virus, and he came back a few months later and that tooth looked fine. So it's kind of exciting and fun to do this work. What I insist on, and I do lecture to other EAV practitioners, and I insist that they write good reports, because if you guys are as busy as I am, you don't have time to learn all there is about reading an EAV assessment. So for me, the practitioner, I have to make your work as easy as I possibly can, because it's too complicated to go through, reams and reams and reams of paper and try and figure out what's going on. So I insist on good reporting, and I say things like moderate inflammation with stress, energetically isolated on tooth number 4, cadmium and mercury energetically isolated on this tooth. So immediately there's cadmium, mercury. Cadmium energetically isolated on tooth number 2, cadmium and mercury and palladium energetically isolated on tooth number 3. I get referrals from Warner Robins a lot. They drive into Atlanta from the military bases, big military base in Warner Robins in Georgia. Those guys have got all kinds of metals in their mouths. All sorts of things you pick up there. And then just, to give you an idea, no cavitations energetically isolated on orthodontics assessed, 2 mercury amalgams, removals 2 months apart, energetically indicated, just to give you an idea. Histograms, that's what the graphs are called, histograms. See histograms for further details. I always send a full copy of the assessment and results of screening forwarded to clients and dentists. So in conclusion, electro-acupuncture has been used as an effective tool to assist dentists and their clients to make informed decisions. Electro-acupuncture is not used to diagnose or treat, but it can act as an extremely viable resource to those who utilize it. So, thank you so much. I feel as though I was a